Nancy, I completely understand your concerns about the risk of chiropractic care and the correlation with stroke. This is a common misconception that a chiropractic adjustment can cause a stroke. There have been cases of stroke days following a chiropractic adjustment, but this is a correlation and not a causation. The symptoms prior to stroke or even during a stroke include neck pain and headaches, and this is commonly what people go to see a chiropractor for or their primary care physician. Speaking to that, a study in the BMC journal by Kosloff, Elton, Dow, and Bannister concluded that there was also a significant association, between primary care physician visits and the incidence of stroke, because patients report to their primary care physician for relief of symptoms, and if the symptoms that they're having are not recognized as stroke symptoms, then ultimately the patient will end up having a stroke. The study also concluded that there's not a significant association between chiropractic manipulation and a risk for stroke. And then in almost a third of the cases of stroke, chiropractic manipulation was not reported in documentation as a treatment for the patient prior to the stroke. In another study found in the PMC journal, it studied stroke risk between the ages of 66 and 99 for chiropractic treatment. It found that the incidence was so low that it was even difficult to analyze. This study also found that CMT is very unlikely to cause stroke, and that the incidence of stroke following a visit to the PCP, or primary care physician, was higher than a visit to the chiropractor. To further ease your nerves, I have been educated in recognizing and addressing the symptoms of stroke, and so that is the most important step in preventing a stroke and then preventing complications if a stroke is occurring, is to recognize the symptoms. So rest assured that if you ever come into my office and you are presenting with symptoms that are out of the ordinary, then we will immediately deal with those and address those symptoms before we ever perform a chiropractic adjustment.